Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in metropolitan Phoenix and Scottsdale, Arizona. The topic for today is medial branch blocks for facet arthritis. Facet arthritis is one of the most common problems causing back and neck pain in the United States. Facet arthritis can occur from generic just wear and tear over a cumulative period of time. It's just like any other joint in the body, which has cartilage, which can start to degenerate and wear away, and the end result can be pain to patients. Facet joints are on each side of the spine at every level, so there's a lot of them. It's not just like you have arthritis in one hip, say your right hip, and you're dealing with that and that alone. Usually if you have arthritis in one facet joint, you have it in probably 2, 3, or 4. So it's not such a simple problem as one joint of an issue. So medial branches are the tiny little nerve endings that supply sensation to the facet joint. The facet joint, just like other joints, has to have pain occurring from something, meaning the joints have nerve endings that supply sensation to the joint. If you can deaden the pain from those tiny little nerve endings, you can dramatically decrease a person's pain in their back or their neck. You may have facet arthritis from a whiplash injury that you had from a car accident a few years ago. A lot of times whiplash injuries are associated with facet joint damage that can then go on to arthritis. That's called post-traumatic arthritis, and you can end up with long-term pain from that. Surgery is not a very good answer for pain that is just in the neck from facet joint arthritis. It's actually not a good answer in the low back either for multiple levels of facet joint arthritis. Those problems are best served non-operatively. So, a medial branch block is when, as an outpatient procedure, and you don't necessarily need IV sedation for this, you can just have numbing from the skin all the way down to the outside area of the spine where the little joints are. Under an x-ray machine, the pain doctor, of which ours are board certified and fellowship trained at Preferred Pain Center, will inject some numbing medicine, maybe along with some steroid, around the joint area to cover the medial branches, therefore blocking the pain coming to the joint or coming out of the joint and telling your brain you have pain. It blocks that pain, and that's called a medial branch block. So a medial branch block can be very effective both as a diagnostic tool, telling the pain doctor and the patient, yes, your pain is coming from this joint. Yes, it got deadened when I injected the numbing medicine. The pain, or a lot of it, went away. And then the good thing about it is it can also be therapeutic. That pain relief may last for months. Now, you can have a series of injections for the facet pain with medial branch blocks, or you can end up going on to what's called a radio frequency ablation. Fancy name, simple concept. It's basically a medial branch block. Instead of medication, you heat up those medial branches and really deaden them, and that pain relief can last for 6 to 24 months. So a longer method of pain relief. Those little medial branches will grow back, and the pain may or may not come back with it, but it's a very effective method of pain relief. So to read more about medial branch blocks and facet arthritis, please visit our website at www.preferredpaincenter.com. I also run the blog of pain. That's at blog.preferredpaincenter.com. Also, give us a call at 602-507-6550. We take major medical insurance. We work with self-pay patients. We do a lot of personal injury work. We get patients in very quickly. We also offer chiropractic treatment, physical therapy, spinal decompression treatment, which can be very effective for facet arthritis, as well as acupuncture. We have a certified acupuncturist, and weight loss options as well. Preferred Pain Center, the pain stops here.